Hi, my name is Jaseni Geronimo, and this is my drug educational infomercial presentation on LSD. The official name of LSD is lysergic acid diethylamide. Common street names include Lucy, Acid, Boomers, Dots, Microdot, Looney Tunes, Pain, Yellow Sunshine, Berry, Acid, Zen, and Lucy May. History: LSD was first synthesized in 1938 by Swiss chemist Albert Hofmann. He first discovered its powerful psychedelic effects in 1943 after accidental ingestion. Initially, LSD was explored for psychiatric use due to its similarity to serotonin and for its safety profile. LSD was experimentally used to treat alcoholism and schizophrenia. By the mid-1960s, LSD became central to youth counterculture in places like San Francisco and London, influencing art, music, and social movements. Through events like the acid test and figures such as Elsie Stanley and Michael Hollingshead, LSD inspired distinct visual art styles, musical innovations, and it had a long-lasting cultural impact. Method of use: LSD is typically ingested orally. Some people inhale it through their nose in its white powder form or inject it into a vein. Schedule category: LSD is a Schedule 1 drug that has a high potential for abuse and the potential to create severe psychological and or physical dependence. Medicinal use and legality: LSD is illegal under the Controlled Substance Act. Effects on brain chemistry: LSD interacts with the serotonin receptors, particularly the 5-HT2A receptor subtype. LSD's molecular structure allows it to bind more tightly and longer to these receptors, leading to a profound disruption of normal serotonin transmission. The alteration of serotonin is believed to be responsible for many of the effects of LSD. LSD doesn't release or block serotonin, but it mimics serotonin by activating its receptors to act more intensely and to last longer. LSD also similarly binds to dopamine receptors, particularly the D2, at higher doses in later phases of LSD experience, which can contribute to states of alertness, euphoria, and sometimes even anxiety. Toxic levels: LSD is not considered to be toxic, and there have been very few deaths associated with LSD overdose. Tolerance information: because LSD develops rapidly, tolerance can develop within 24 hours of taking LSD. The peak tolerance occurs around 48 to 72 hours after the last dose. Withdrawal symptoms: LSD is not considered physically active, thus it has no physical withdrawal symptoms. Instead, when a person abuses LSD, they develop a psychological dependence leading to psychological withdrawal symptoms. The individual may not experience physical pain, sweating, or nausea, but they can exhibit unpredictable emotions such as anxiety, lack of concentration, confusion, depersonalization, or flashback episodes, as well as a strong desire to take more LSD. Overdose levels and symptoms. There is no lethal dose of LSD, so it would be extremely difficult to have a physiological overdose. There is no direct answer as to how much LSD is required to overdose. Research suggests that a dose ranging from 50 to 200 micrograms is non-toxic and medically safe. However, a research paper titled LSD Overdoses, 3 Case Reports references a study of a 15-year-old who accidentally ingested between 1,000 to 1,200 micrograms of LSD at a party and had to be hospitalized overnight. However, if someone takes large amounts of LSD, it can be dangerous because high doses may cause terrifying hallucinations, paranoia, confusion, psychosis symptoms, a warped sense of time, risky behavior leading to accidents, and it could trigger or worsen psychotic disorders. Physically, LSD may cause a dry mouth, increased sweating, loss of coordination, and an increased heart rate. Cost of the drug. A single dose of LSD can be bought and sold for as little as $5 to $20. Prices can fluctuate dramatically depending on its purity level, the location of sale, current availability, and law enforcement presence. Trends of usage in the U.S. According to a study by researchers at Columbia University Mailman School of Public Health and the Columbia University Irving Medical Center, an estimated 5.5 plus million people in the U.S. used hallucinogens in the past year, in 2019 representing an increase from 1.7% of the population aged 12 years and over in 2002 to 2.2% in 2019. From 2002 to 2019, the prevalence of 12-month LSD use increased significantly amongst respondents aged 12 to 17 years. However, the perception of considerable risk for regular LSD use decreased significantly overall for the years from 2002 to 2014 among all age groups. Trend of usage in the world. In many places, the prevalence of LSD usage remains low, below 1%, though there are some expectations. Among young adults aged 15 to 34, recent national surveys show last year prevalence estimates for both LSD and hallucinogenic mushroom is equal to or less than 1%. Exceptions for LSD below 1% include Ireland, Finland, Estonia, Latvia, Norway, and the Netherlands. Trends in terms of age, gender, and ethnicity. Compared to non-LSD users, in the past year, LSD users were disproportionately male between the ages of 18 to 25 and white. One interesting fact about LSD is that the CIA investigated LSD as part of the MKUltra program, studying its potential use in brainwashing and psychological warfare. Recommended websites and documentaries to learn more about LSD. Arrowwood is a non-profit educational and harm reduction website that includes user-reported risk with LSD and other psychedelics, as well as information regarding dosing risk and legal size. The Truth About LSD is a website that offers a free course to learn about LSD regarding its street names, history, and its effects. How to Change Your Mind is a docuseries that focuses on LSD and other psychedelics. Here is my reference page, and that concludes the end of this presentation.